Hello. Come to see Brian to have a little look at his wounds.
All right,
Is that all right? Okay. He's a gentleman who came in just before Christmas. Unfortunately, during that time, he's developed heel ulcers, bed sores on his heels. We've been treating those. One of them is almost healed, and the other one we're still trying to clean up. So this is a wound, or these are both wounds that will be colonised with bacteria. I mean, if we were to swab these wounds now, we would grow a selection of bacteria. That's what we would expect to find.
The fact is, with the wound swabs, you're always going to get something. If you swab somebody's skin, you'll always get a bug. And you can bet your life, you take a swab, goes to the doctor looks at it and says, oh, bug, antibiotic. They may not even think about alternatives.
Established or chronic wounds will be always colonized with bacteria. They are not sterile, and those are mainly non-pathogens, and they will be sitting there, not harming the patient, so there's no need to treat them.
If you're going to look at these established wounds, the vast majority of them need something else. They need the stitches taken out. They need a good hot bath. You know, they need cleaning up. They need foreign material removed. They need the underlying cause sorted out. They need their diabetes sorted out. They don't need antibiotics.
The labs now are much stricter about what they process and what they don't. So the nursing staff have to make sure they put all the relevant clinical information on the request form.
Rather than just trying to teach people about what's right and what's wrong, we would put a brake on the kind of swabs that we thought were unnecessary wounds, i.e. define the wounds that don't need them. Then if anybody swabs them, just say, sorry mate, we're not going to do this.
I think before there were too many swabs being processed, and then sometimes patients were starting antibiotic treatment on the basis of a swab result.
Once we decided to establish the new protocol, we communicated widely and asked them to include clinical information which suggested infections such as redness, inflammation, pain, increased white cell count, all the markers of inflammation. And if they included that information on the request form, they would process the specimen, otherwise we wouldn't.
The fact that they're two departments saying the same thing, seen from the same input, that makes a lot of difference.
It's a clinical decision, usually by the doctor or by the prescriber, whether to start antibiotic treatment, but it's based on what you're seeing in the patient rather than what you've managed to locate on a swab.
We reduced about 30% of the workload on wound swabs, so we can then use our time with more relevant specimens.
Every wound swab is nearly £10 if you take the entire global cost. The actual disposables are less than £2, but it's really pretty expensive. And we do, just in a small hospital like this, from our own work, perhaps 6,000 or 7,000 a year.
It's cutting down on serious infections, we hope. It's cutting down on the use of antibiotics, so that will save money. It's cutting down on lab time doing unnecessary cultures, so that saves money. So it's sort of win in all directions.
We are working now to establish a laboratory network in Kent. The director of the pathology network and also the chair of the microbiology group decided that there was a good incentive for them to roll out the policy across Kent, and so we did it.
It's getting across the message that if there's an open, long-standing wound, such as particularly leg ulcers, if there's no associated cellulitis, inflammation, infection, no systemic effects, they do not need swabbing and antibiotics.
For me, as a wound care specialist, it means the patient gets the treatment they need when they need it, and if we can treat topically and treat the bacteria in the wound with antiseptics or maggots or other dressing products, and they don't end up with an infection, then they don't need antibiotics.
So the innovative bit is persuading people they don't actually need to swab things.